Hello, my name is Mimi Kang, and I will be presenting a case report and case management function on a patient who experienced an acute exacerbation of chronic obstructive pulmonary disease, also known as COPD, as a staff nurse without a nurse in case management. This patient was a 68-year-old African American male with a long history of cigarette smoking who was admitted for acute exacerbation of chronic obstructive pulmonary disease, also known as COPD. When I was assigned to care for this patient, it was already his third day since diagnosis and hospitalization. He was considered to be in the low socioeconomic status and he was receiving Medicare benefits. This patient was single but had his family at bedside supporting him. Based on my assessment for this patient, his self-care capacity was determined to be difficult to maintain health and well-being of self effectively. He was in need of assistance from his family and medical care team. It didn't help that he couldn't make changes to modifiable risk factors such as cigarette smoking. He also had a hard time following his medication regimen and needed assistance with performing his activities of daily living from his family. This patient required pharmacological and non-pharmacological treatments, such as breathing treatments, oral medications, oxygen therapy, antibiotics, education, breathing techniques, and suctioning. There were several issues with this patient that was noted to incorporate into the discharge planning. This patient's functionality in terms of activities of daily living needed some assistance. He was able to feed himself and experienced no difficulty with elimination. However, due to his severe shortness of breath and difficulty in breathing with activities, he needed assistance with bathing, dressing, and walking. In terms of his functionality of the instrumental activities of daily living, patient required assistance with meal preparations, house cleaning, transportation, and following medication regimen. Living with his condition has made him much shorter tempered due to his difficulty in breathing and frustration. Based on his history and current issues, the patient can be discharged to home with family with follow-up visits scheduled with his primary care provider. This patient will need home health visits to follow up on his self-care, physical condition, and to ensure positive outcomes. He may benefit from referrals from social groups, counseling, support groups, and follow up with telephone conferences. Nursing case management strategies can be divided into the patient and system level strategies. In the patient level, some of the strategies include patient education, helping patient build self-efficacy, and teaching signs and symptoms. In the system level, we can collaborate with the patient and the healthcare team and perform early detection and prevention. In the patient level, it is important to educate the patient to provide accurate knowledge and skills of self management and to provide better understanding of self care and outcomes. In order to help the patient build his self efficacy, the ability for the patient to believe his capacity to make a positive change in his medical condition. The patient may be supported with referrals and resources to support him emotionally, mentally, and spiritually. By teaching the patient about signs and symptoms, we are able to recognize disease occurrences early and prevent exacerbations. In the system level, collaboration between the patient and healthcare team can bring positive health outcomes. During the collaboration process, self-promotion management involves providing and making sure that the patient has accurate knowledge and skills to self-manage. By performing the patient of the By informing the patient of the positive outcomes, patient may be motivated and continue to set for positive outcomes. Having a early detection and prevention program prevents exacerbation and rehospitalizations. In order to perform a utilization review, subjective and objective data may be reviewed before and after nursing case management interventions were carried out by the patient. The nurse may compare and contrast these data and evaluate the effectiveness based on health outcomes and patient's review on interventions through follow-up visits and interviews. During these interviews, new assessments and data collection is necessary for the strategies that were performed and what their outcomes were. Some of the factors to consider to improve quality and safety in nursing case management is to provide approachable interventions to the patient that patient is actually able to carry out. Having the resources available to the patient's new case management plan would improve outcome results as the patient is able to have his resources available. Having support groups may decrease the safety issues patient may encounter. Patient's standard of living should be considered so that there are no safety problems and patient is able to access his resources early or easily. To evaluate effectiveness at patient level, patient may be interviewed to review the effectiveness of discharge teaching he had received, such as medication administration techniques, and psychological assessments. To evaluate effectiveness at the system level, services provided by the case management level can be evaluated to reinforce teachings, clarify any misinformation, unclear understandings, and reminders for the patient to maintain self care management to improve health and well being. Home visit evaluations can assess for effectiveness on the additional supports patient received after discharge, such as how the patient has been effectively administering oxygen, using their inhaler, positioning, and other comfort measures.